News at 7.
All right, 7:41 now. Can you develop allergies later in life? Dr. Richard Chaffoo making a house call this morning to explain adult onset allergies. My wife, doctor, good morning, first of all.
Good morning, Raoul.
My wife is convinced that this is what's happening to me now, and I keep saying, hey, I got a runny nose. I may have a cold. It's like, you're getting allergies. Can that happen?
It can, Raoul. You know, they've done a large national survey, and they showed that about 52% of American adults actually develop their allergies after the age of 18. So we always think of allergies beginning in childhood. But what's also interesting is that when they pressed these people further and got more of a history, many of them had forgotten they actually had some allergy-like symptoms or some allergies when they were young as a child and just had forgotten that.
How do you know if we have developed an allergy? Do you have to go get tested?
Well, that's a great question. I mean, if the most common allergy that we see in adults is like in children is a food allergy, and the most common being shellfish. So probably if you've ingested fish or shellfish and you start getting an itching or tingling in the mouth, that's an early sign that you may have an allergy. Obvious things like, you know, rashes, swelling, those are more obvious types of things. But it doesn't mean because you've had a reaction one time to that specific food, it's going to happen again. But certainly if it does recur, that's the time to get in to see an allergist.
Okay, you mentioned 18 and up, but can it happen even later in life, say after you hit 40?
It can, but it's rare at that point. Because remember, as we get older, our immune system begins to get a bit weaker. And so the good news is if you get an allergy when you're 18, you're going to at some point outgrow that, or let's say the symptoms will be less.
Interesting. Okay, so what is it within the body that causes this change? I know there's things constantly moving around and changing as we get older.
Correct. You know, no one knows for sure. There are some anecdotal reports of people that have been pregnant or had a virus following that. They actually developed an allergy.
Right.
But we think that it's somehow the body's changing or alteration of the immune system, responding to some other stimulus, whether it was a pregnancy, whether it was a serious viral illness. Something, for example, you might have eaten a food for a long time and never really had an allergy to it, but then suddenly one day you had an allergy. So the concept is maybe that you've continued to stimulate the person with that same allergen over and over again, and ultimately they mount an immune response and you develop an allergy from that.
That's fascinating. So a lot of people, when they get these later in life, is it going to stick with them for the rest of their lives, or can it magically, just as it came onset, it goes away?
It can typically go away later on in life as our immune system begins to get, you know, more attenuated, a bit weaker as we get older. It's unusual to see an allergy in a senior citizen developing. Mostly it's about the age of 18. Once you're in your 40s to 50s, we'll oftentimes see a change in that picture where the allergy may not get as severe or may go away altogether.
My wife is convinced I am lactose intolerant, Doc. Maybe I need to
Could be.
I don't know why. I've been drinking milk, ice cream my whole life. And she's like, oh, you're lactose. I don't know. Maybe things are changing. Doctor, thanks for joining us this morning. Great information.
Sure.
All right, time right now is 7:44. Oh.